Okay, perfect. So, without further ado, we can get started then. Yeah, so everybody, welcome on in. Thank you for coming this Saturday morning. So just on the slide there, you'll see I've got a copy of a QR code that can take you to our pre-seminar survey. There's also a link down there as well. So if you are interested in contributing to the research, it's basically just giving us a bit more insight on how we can improve the talks going forward. So yeah, if you are interested in doing that, please feel free to do so. And you will be receiving these slides all after the presentation. So all of these links and everything will also be in there. Okay, so the 2023-2024 Mini Med School lecture series. So at this point, we've gone through a fair amount of them. So Michael started us off strong by going through the new Canadian alcohol use guidelines early in November. And then I followed it up with the Accessing a Family Doctor in BC talk. We've had the Skin Conditions and Concerns talk, and that brings us to today, which is going to be a talk on depression in the elderly. So following this, we'll actually have a few more talks. So Michael will be performing another talk on Ozempic and other GLP-1 agonists, and then I'll be finishing up the Mini Med School lecture series for this year, giving a talk on artificial intelligence in healthcare. So, but once again, the focus for today is going to be depression in the elderly. So just to give a bit of an outline for how this talk is going to go here today, we're going to start off talking about the significance of depression in the elderly and essentially why we're having this talk and why it's important. And following that, we're going to go over recognizing depression. So signs, symptoms, potentially in yourself and others, and kind of how that process works. And then finally, going to be going over an approach to depression in terms of things that a clinician might do if you go and see them in their office for it, or some things that you can do yourself to aid in depression, or for anyone else who this information might apply to as well. Okay, so a brief rundown of the timeline for today. So we got started a few minutes late, just letting a few more people come in, but roughly we're going from 9 a.m. Until potentially 10:30. We may end a little bit a bit early, but we'll definitely be out of here by 10:30. So there will be a 10-minute break, an intermission period within the talk. So if you need to get up, stretch your legs or whatnot, or fill out one of the surveys, we'll give you an opportunity to do so. And then at the end of this presentation, we will be having a question and answer period. So this will be going on for about 15 minutes or so, just about any questions you had regarding the presentation or the topic more broadly. Okay, so so let's go a little bit into who we are. So my name is Derek. I'm a second-year medical student at UBC. I'm joined here today by my colleague Michael, who's also a second-year medical student. He's in the Island program, and I'm over in Vancouver. But yeah, so just a few disclosures before we get started here. So given that we're both second-year medical students, we are not doctors. So if you do have any specific questions regarding your health, or please do consult your healthcare professional. And these sessions really are going to be serving as more of a general overview of the topic. So there may be certain specifics that we don't dive into, or you may actually know more than we do in certain areas. So this will just sort of be a general overview on the topic and hopefully give you an idea of the topic at large. And this session will also be recorded so that you guys can watch it in the future, and it will be posted on our supervisor, Dr. Jane Gair's website, who I believe may be joining us today. So you will have access to this recording in the future. But with that being said, if at this point you do want to mute your mic or turn off your cameras, if you don't wish to be recorded, feel free to do so. So I'd also like to acknowledge that I am joining you from the UBC Vancouver campus, which is situated within the traditional, ancestral, and unceded territory of the Musqueam. Okay, so and like Michael said within the chat, feel free to put your questions in the chat at any point. Michael may be able to answer them, or we may leave them until the end for the question and answer period. Okay, so starting with the significance of depression in the elderly. And before I do so, I did just want to do sort of a general disclaimer here. So we are going to be talking about some sensitive topics today, namely depression, and potentially as well as elder abuse and things of that nature. So if you do feel uncomfortable at any point and need to excuse yourself, please feel free to do so. And we also will be sharing resources. Near the end of this presentation, we'll have a slide on some resources for you or anyone else potentially to use if you're experiencing any of these issues. Okay, so let's start off with a poll, actually. So the question that we're going to start off here is, let me just launch the poll so you can all see it. It's by 2030, what proportion of the population will be age 60 or older? So let's launch this poll. Great. Yeah, so you can see we got a few options there. So what proportion could be 1 in 10, 1 in 8, 1 in 6, or 1 in 4? Yeah, so please feel free to lock in your answers and participate. Okay, looks like we've got some good responses coming in. So I'll give us just about 10 more seconds, then I'll close the poll here and I'll show you all the results. Okay, closing in 3, 2, 1. Okay, so you can see the majority of the responses were saying about 1 in 4, and then a decent amount of people are also saying 1 in 6. So the answer is that by 2030, 1 in 6 people will be age 60 or older. So what's the importance of that? Well, namely, it's to show that we do have an aging population and that this is a significant age bracket and will only continue to grow in the future. So to give you a bit more context on this, so as I said, we do have an aging population whereby recent estimates, so in 2020, there were roughly 1 billion people aged 60 or older, and it is estimated that by 2030, this number is going to increase to 1.4 billion of people aged 60 or older. And that's sort of where we get the rough proportion of 1 in 6 of the population. So this is really all to show that it is clear that individuals age 60 or older are a significant part of the population, and it seems will only continue to grow in the near future here. So another poll for you all. I'll just launch it here. Okay. Yeah, so how common are mental health disorders within those aged 60 or older? So we got a few percentages for you to choose from there. Okay, some good responses coming in here. We'll give another about 10 seconds. Okay, closing in 5 seconds here. 3, 2, 1. Sharing the results. Okay, so sort of a bit split here. We can see the majority of people did say around 20%. Some people were saying around 15, and a few were saying about 10%. So the answer is specifically it's about 14, but basically like 15% of adults, so aged 60 or older, live with a mental health disorder. So this is to show that depression and mental illness is fairly common within elderly people or people aged 60 or older. And according to the World Health Organization, um, uh, uh, yeah, that's sort of where we get these numbers from, this 14%. So yeah, roughly 14% of people age 60 or older. And another stat that's worth mentioning as well is that roughly a quarter of the deaths from suicide are from those aged 60 or older. So giving you a bit more context on this. So elderly individuals can also be at a greater risk for depression. And this can be due to quite a variety of different reasons. Just so to start off with here, so for instance, as mentioned by the Center for Disease Control, or CDC, it is more common for people with chronic health conditions or those whose function is limited to develop depression. And given that at least 80% of elderly individuals have at least one chronic condition and 50% have two or more, this does put the population at a greater risk for developing depression. So some other significant risk factors that are worth mentioning as well include social isolation and loneliness. So according to the World Health Organization, this does affect about 1 in 4 older people and can have similar impacts on mortality to well-established factors such as smoking, obesity, or physical inactivity. So something that can also contribute towards increased risk for depression within this population is the abuse of the elderly. So it is estimated by the World Health Organization to occur in roughly 1 in 6 individuals age 60 or older. And these numbers are even higher within institutional settings, such as care facilities, where it was reported that 2 out of 3 staff reported that they have committed elder abuse within the past year that the study was taken in. So there are obviously a lot of different factors that can contribute to this. So here are a number of other factors which can also contribute to an increased risk within the elderly population or the population 60 or older that can lead to increased risk of depression. So I mentioned this one a bit earlier, but loss in functional ability. There also could be some older individuals may also experience a decreased purpose or feeling of purpose after retirement or during retirement. There can also be a decrease in income, which may put financial stress and contribute to this, as well as bereavement or loss of a loved one. In addition to caregiver stress, so oftentimes people within this population may be caring for others, and that can contribute stress, which may in turn lead to risk for depression. And then some other factors could be lack of physical activity, whether that be due to chronic health concerns or otherwise. And also some other factors that can contribute include substance use and sleep disorders. Okay, so I hope sort of after laying all of this out, it is clear that depression within the elderly population is a significant issue and some of the reasons why this is the case. So now I am going to switch to talk about some of the ways in which we can recognize depression. Okay, so what I want to start off with here first is a little bit of about the current state of recognition of depression within this population. So currently, recognition of depression within the elderly population is actually quite poor. So in part, this can be due to some misconceptions surrounding depression and aging, and the misconception being that depression is a normal part of aging. And this is a belief that can often be held by both health practitioners and by patients. And to give you a bit more info on this, so in a study by Mental Health America, it was found out that for people over the age of 65, 68% of these people stated that they know little or nothing about uh, that they know little or almost nothing about depression, and only 38% stated that depression is a health problem. Moreover, for this group, um, so this group of people aged 65 or older, this group was more likely than any other group that was sampled to try and handle the problem themselves, where only 42% of them would actually reach out to a healthcare professional for help. So really, so to clarify, if there is only one thing that you take away from this presentation, I hope that it's this. So as mentioned by the Center for Disease Control, or CDC, depression is not a normal part of growing older. So as a result of this, it is important for patients and healthcare practitioners alike to recognize some of the signs and symptoms of depression in order to not misdiagnose and undertreat depression within this population. So then going a little bit more in depth to some of the signs and symptoms of depression here. Okay, so these are some of the more common signs and symptoms, which can often last for weeks at a time for depression. So some of these can include things like sadness, fatigue, hopelessness, irritability, insomnia, or excessive sleeping, suicidal thoughts, self-harm thoughts, difficulty concentrating, or a change in appetite. So that could be a loss of appetite or potentially eating more than usual. And also a loss of interest in activities that were once pleasurable or the person enjoyed. And there's also a number of factors that aren't mentioned here because depression can show up in a number of different ways. But these are some of the more common signs and symptoms to sort of watch out for. So really, overall, it is important to know that depression, as I was saying earlier and mentioned by the Center for Disease Control, that depression, first and foremost, is a health problem and that it is not a normal part of aging. So if you do notice any of these signs or symptoms within yourself or anyone or any loved ones, please be sure to reach out to your healthcare professional for further evaluation. Okay, so that does bring us to the 10-minute break portion here. So once again, feel free to get up and stretch your legs or anything if need be. And we will give you some time here. I think Michael's already put it in the chat, but maybe for a few of you who joined a little bit later, he can put it in the chat again. The link to our pre-lecture survey, which we would be still fine to fill out because we're not quite done the presentation yet. So if you do, if you would like to do that within this time period, that would be greatly appreciated. Okay, so I will leave it there then, and we will be back in 10 minutes. Okay, so I will see everyone soon. Okay, so welcome back, everyone. I hope you all had a good break. So yeah, we're gonna continue on now. Um, okay, so this brings us to the sort of final portion of the presentation, which is going to be focusing on an approach to depression. So basically, so now we went over a bit of initially the significance of depression in the elderly, so why we're talking about it, its prevalence, and the importance of it, and things of that nature. And then we went into some of the signs and symptoms for depression, as well as hopefully underscoring the fact that depression is not a normal part of aging. So once again, that's sort of one of the main takeaway points here. So if you or anyone else that you know maybe experiencing any of these signs and symptoms, once again, please reach out to a healthcare professional. Okay, so upon reaching out to a healthcare professional regarding any symptoms that you may be experiencing regarding depression, so what happens next? So initially, your health practitioner may ask you a number of questions about your feelings or some of the symptoms that I did mention earlier. In addition, they also may try and rule out other medical problems that could present similarly to depression to make sure that that's not what that isn't what's causing the symptoms. So some of these other conditions could be things such as hypothyroidism, stroke, dementia, or vitamin B12 deficiency, anemia. And they also may perform a physical, and they also may perform a physical exam. Okay, so upon diagnosis, there are a number of different treatment options available. So one example is psychotherapy, or often better known as talk therapy, where a patient would work with a psychologist, a psychiatrist, or another mental health professional to both identify and change certain thoughts and behaviors that may be contributing towards depression. Now, another common form of treatment does include medications, namely SSRIs, which means selective serotonin reuptake inhibitors. And these are essentially antidepressants. And there also are a number of other depression treatments. However, these are some of the most common ones, so sort of most important in mentioning. So to go into this a little bit further here. So here's a diagram. This is essentially just kind of laying out how SSRIs work. So what we have here is a synapse, which is just where two neurons in the brain connect. So you can see at the top there, it's saying presynaptic nerve ending. So that's one neuron. And then postsynaptic nerve ending, that's another neuron. And then the synapse is the place in between these where things such as serotonin get released from the presynaptic neuron into the synapse, and then serotonin can bind to receptors on the postsynaptic neuron there. Now, how the medication actually works. So it is based off of theories that serotonin, based off theories about the connection of serotonin to depression. And basically what it acts to do is to increase the level and activity of serotonin within the brain. And so specifically how it does this, so like the name suggests, it's a serotonin reuptake inhibitor. So sometimes serotonin will get reuptake will occur, which means it will get taken from the synapse and go back into the presynaptic neuron. So SSRIs stop serotonin from getting reuptaked into the presynaptic neuron. So therefore, there's more serotonin within the synapse, and therefore more serotonin can bind to these receptor sites, therefore increasing the activity, they're increasing serotonin's activity within the brain. So some common examples of these that you might have heard of. Here's a few of the names. So one of them is sertraline, or known as Zoloft. There's fluoxetine, or known as Prozac. There's citalopram, also known as Celexa, and then Lexapro, and then the paroxetine, or known as Paxil or Pexiva. So some common side effects of these medications. Once again, these are just possible potential side effects, and this is not an exhaustive list. These are just kind of some of the more common or more frequently mentioned ones. So yeah, a few of them, as you can see, could be headache or drowsiness, insomnia, nausea, vomiting, diarrhea, or dry mouth, agitation, restlessness, or appetite changes. So these appetite changes could either be reduction or increase, so leading to either weight gain or weight loss. There can also be some sexual side effects, whether that be erectile dysfunction or some issues reaching orgasm or decreased sexual desire. So after talking about sort of all these different medications and sort of clinical treatments that that healthcare professionals can prescribe. So what are some things that people themselves can actually do to help improve their mental health? So we're going to do another poll here on what we think some of these may be. So I'll launch the poll right about now. Great. Yeah. So what are some actions patients can take to improve their mental health? And it looks like the for some reason the last option didn't get carried over, which is all of the above. So that's another option as well. Yeah, so we'll let you guys submit it here then. But yeah, there is also an option for all of the above, which unfortunately isn't showing up, but sort of worth mentioning there. Okay, we'll close the poll then here in about 3, 2, 1. Okay, and sort of balanced contributions into the poll there. So yeah, sort of as I was alluding to there, really any and all of the above can help improve mental health. So some of the ways that we can do this, and a few of these were mentioned, would be regular physical activity, in addition to a balanced diet, and staying connected to friends and family, as well as ensuring adequate sleep and also avoiding substance use or alcohol use. As I did mention earlier, that substance use can be a risk factor for depression. So after talking about all this, it is important to also go over some resources and kind of talk about how you would potentially go about reaching out for help if you or someone else was experiencing any of these symptoms. So once again, just wanted to understate that depression is a health concern. So please reach out. Please reach out to someone, a health practitioner, to help you with this health concern if that's something that you may be experiencing. So this could be someone like a family doctor, a psychiatrist, a counselor, or reaching out to some of the online resources, which will be on our next slide here. And I'll go over a little bit about those. Okay, so the first link, and once again, we'll be sending out these slides after the presentation, so you'll have access to all of these resources. So the first resource listed there is a link to support for anyone who may be experiencing or has experienced elder abuse. And then another one following that is Bell Let's Talk, which is sort of a more broad mental health support resource. And another one there is Help Starts Here, which is a link for addiction support as well, because as mentioned a few times, substance use is sort of linked and a risk factor for depression. So I wanted to provide that resource there. Another one is Wellness Together, which provides both mental health and substance use support. And then, so something that's run through UVic as well, and is sort of a comprehensive center regarding aging and lifelong health, and a lot of the factors that contribute to that there. And then the final one here is sort of it's from the Government of Canada. So there's a number of links and resources through there from the Government of Canada that you can check out in that last link. So we're kind of nearing the end of the presentation here. So we've got one more poll here that I will open. Just looking for a bit of feedback, sort of going forward about how we may conduct these sessions. So in the future, for mini med school sessions, how would you like it to be delivered? So over Zoom, in person, a mix, or if you do have any other suggestions, feel free to message it in the chat here, or email us. And I think you would all have our email. You can just use the email that you've been receiving from us. So we'll give everyone a few more seconds here. Give everyone about 10 more seconds to fill out the poll, and then we'll see what everyone's thinking. Okay, it looks like pretty much everyone submitted, so we'll close now. Yeah, so we're getting some varied results so far. So it looks like some people are saying over Zoom or in person, and some people are saying a bit of a mix of both. So we'll definitely take all that under advisement and sort of think about how it may be best to conduct these sessions going forward. But once again, if you do have any more feedback on that, feel free to let us know and get in contact with us. So then a final summary slide here, just kind of outlining everything that we went over a bit today. So we do have an aging population, and within this aging population, there is an increased risk for developing depression. Once again, just wanted to state that depression is not a normal part of aging. So as a result of that, it is really important that we do recognize symptoms and reach out to healthcare professionals if you do experience any of the symptoms that we went over here. And then we also talked a little bit about how an office visit or a clinic visit might occur in terms of depression, diagnosis, and some of the things that you can do yourself, as well as a clinician may do to aid with this. Okay, and here are all of my references. So if you want to check out any of this, any of what I was talking about in a little bit more detail, feel free to use any of these links here. And then finally, that does bring us to the question and answer period. So just before we get into that, there is a link that you can all see here. There's a QR code as well as a link, and maybe Michael can post the link if he has it into the chat, so you can just click on it there. But yeah, please do consider filling out our post-lecture survey. It provides really valuable feedback for us in terms of conducting these sessions going forward and how to make it as effective as possible. So I'll start looking I'll start looking in the chat here and start trying to answer some of these questions. So let me scroll back a little bit and see what we got. Okay. Yeah, so it looked like we were having a nice a back and forth discussion there. I just about the process of aging and sort of how that relates to the development of depression there. So I won't touch on that too much more. I think Michael and Dr. Gair provided great feedback on there in the chat. So yeah, if anyone does have any more questions, feel free if you want to type it in the chat, or if you want to unmute your mic and you want to talk about it, either or works for me. Okay. Doesn't look like too many questions are coming in as of yet. So we'll maybe give it a few more minutes here just to see if any last minute questions come in. But if not, feel free also um, to follow up with us later via email or anything like that if you would like to. Okay. Yeah, we'll maybe give it one more minute. But yeah, I think we'll sort of wrap things up then. So thanks everyone again. Oh, no, look. Oh, hold on. Um, yeah, okay. So it looks like that's probably going to be it for today then. Once again, so thanks everyone for coming in. I appreciate you showing up on this Saturday morning here. Um, And then, yeah, we will once again have the recording for this online on Dr. Gair's website, and you'll have access to all of these resources in the future. One final encouragement, if you would like to complete the post-lecture survey, feel free to do so. We'll also be sending that out in our follow-up email. Okay, so I think that brings us to the end of the presentation here. Thanks everyone once again for coming, and I hope you have a great rest of your day.